This is a special edition of 17 News, the COVID Town Hall. Now, here's Maddie Janssen and Alex Fisher.
Tonight, a crisis looms as coronavirus cases skyrocket in Kern County. Good evening, I'm Alex Fisher.
And I'm Maddie Janssen. Tonight, our top story is the same as it has been for months now. Our community is in the middle of the darkest days of this pandemic so far, and there's no sign of slowing. Here are the numbers as of today. 82,398 people have been infected with the virus. That's 1 in 11 people who live in Kern.
And although we've been in the middle of a pandemic for more than 10 months, the most critical days are happening right now. Nearly 44,000 people are currently infected with the virus. That means 1 in 20 people who live in the county are recovering.
The virus has stolen the lives of 551 people since March. August was our deadliest month, followed by July. Those 2 months alone are responsible for nearly half the deaths so far. December was our third deadliest month, and health officials are still counting the fatalities.
It has been a long journey, and here's a look at the number of daily cases, and it appears the numbers continue to be high, as you can see. A vast majority of people who contract this virus do recover, but our hospitals, as you can see, are filling, and they're quickly filling up, and resources are running thin. So here's a look at the number of hospitalizations, and you can see that we are at the worst days so far through this pandemic. And as more people get sick, more people end up in the hospital and ICU. Tonight, our top health officials from the county join us to talk about the threat that our community faces. They'll join us in just a moment. But first, our Bob Price brings us the story of the hospital workers on the front line to show us how they're faring during these difficult days as they work 12, 14, sometimes 16-hour shifts.
Kern County is deep in the throes of the COVID-19 pandemic right now, with 1,000 cases a day on average. And every hospital in the county is participating in the fight.
That includes Bakersfield Heart Hospital, which is known, of course, for cardiac treatment. That it has a COVID-19 ward at all speaks to the urgency of this pandemic. Heart Hospital's modest COVID ICU ward is in fact full. Michelle Oxford is president and CEO of Bakersfield Heart Hospital.
It is getting worse. Yeah, the ambulances keep coming, the patients keep arriving to the emergency department. We keep treating them, but we have seen a significant increase over the past 2 to 3 weeks, and it's not going in the other direction yet.
Many of Heart Hospital's COVID-19 patients first come to them showing symptoms of other problems, heart issues most commonly, of course. The game plan changes when they're diagnosed with COVID-19. Most COVID-19 patients at the Heart Hospital, as at all Kern County hospitals treating the virus, are fully sedated so they don't try to breathe on their own or fight the intubation tubes. The illness is an equal opportunity killer. Emerita Arias, a COVID ward nurse at Bakersfield Heart Hospital, knows all that too well. She's recovered from COVID-19 herself.
We see people here like 40 years old, on ventilator, lungs completely wiped out. So you think, oh, it's going to be only for old people. No. It's affecting all ages.
And as prevalent as infections are right now, there's still almost a sense of disbelief when it strikes. That's been the observation of Carol Ann Stiltner, Heart Hospital's chief nurse executive.
Most of it is that I didn't think it would happen to me, or I didn't think it would happen to my family, and it is very real.
The surge of COVID-19 cases has most hospitals overextending nursing staff out of dire necessity. The ratio of nurses to ICU patients is supposed to be 2 to 1, 2 patients for every 1 nurse. But hospitals are so slammed, many are working with ratios of 3 to 1. That's the case with Nancy Munn, an ICU nurse at Adventist Health Bakersfield, who's been pulling 16-hour shifts.
We have too many patients. There are too many patients for how much staff that there is. And, you know, I know it's kind of common for there to be a nursing shortage, but right now it's pretty bad. They do their best to keep us in ratio, but it's almost impossible when you have people coming in left and right who are needing to be in ICU.
Allison McGee, manager of respiratory care at Bakersfield Memorial Hospital, says some of the images she's seen have left indelible marks.
I've seen a 23-year-old that will last forever. It doesn't pick just elderly people.
What many may not realize, McGee says, is that COVID survivors oftentimes will never be the same.
People who are getting discharged from the hospital are needing therapies after that to get, their lungs aren't the same, or their renal failure isn't the same. Their brain isn't functioning anymore because they were hypoxic for so long. There's everlasting a recoil that happens after they had this.
What can the rest of us do about it? It's pretty simple. Wear that mask. Over your nose, please. Don't mix in groups. Stay home as much as you can. Still don't consider this pandemic something to be concerned about? Nurse Nancy Munn says you would if you could see what she sees every day.
We do have a lot of patients here who just simply don't make it because they're so sick by the time they come in. So if someone could just stand there and see all the beds lined up with all these patients and everybody just gowned up, then maybe it would be a little bit more realistic. But until people have family members that are, died probably from COVID, then they just don't take it seriously enough.
Maybe COVID-19 doubters will come around when some hospital's triage committee informs them they're out of bed space and their family member doesn't meet the criteria for treatment. That's one of the options on the table as hospitals across Kern County totter on the precipice. They're packed already, and the pandemic has not receded.
So Kern County ICU beds on any given day may be very close to zero availability. They don't want to get into negative numbers, but they're close. In Bakersfield, Robert Price, 17 News.
And tonight we are joined by some of the chief medical officers and health officials in our county. Matt Constantine, the director of our local health department, Dr. Himmel Cothry, the chief medical officer for Dignity Health, Dr. Glenn Goldus, the chief medical officer for Kern Medical, Dr. Ronald Reynoso Hernandez with Adventist Health, Bakersfield, and Dr. Joseph Hayes from Omni Family Health. Doctors, thanks so much for joining us this evening. I do appreciate it. Matt, I want to begin with you. We just heard about our hospitalizations here in Kern County. We just saw what it looks like on the front lines. We've seen the numbers. Where are we in this pandemic right now, and what does the situation look like as of today?
Well, unfortunately, we're still seeing some high numbers. We track this very closely. Our numbers today were above 900, and you remember that that's just cases. So every case has approximately 4 contacts. So that's 5,000 people that we're making contact with today to say we have some concerns. So as you said, and Bob Price said in his report, we see a lot of activity at the hospitals. This is not like the surge that we saw in July. This is worse. And of course, we're always worried about how high will it go, but also the length or the duration of the peak that bothers us.
I know it's hard to probably say right now where we're going because I know we have to look at the trends. We can't necessarily look at day-to-day change. But is there any signal here that makes it look like the trends are going down at all?
No, here locally, we don't see any trends. We've heard the governor and some national figures indicate that maybe there's a plateau. We've not seen that here locally. Our numbers are still high. Our ICU beds, as I know my colleagues on this meeting will tell you, are in short supply. So our system is strained. Our ambulance system is strained. We're all working hard, but I don't yet see it slowing down.
Dr. Hayes, let me ask you, the main concern that we've heard from all of you, from the state, from the local level, from the federal level, it's the hospitalizations that is the concern. We do not want to put a strain on our hospitals right now, especially during this time of year when we're dealing with other things like the flu. But I have to ask you, who is ending up in the hospital and in the ICU right now if they are infected with coronavirus?
I'm sorry, I wasn't able to hear your question.
No worries. Who's ending up in the hospital right now if they are infected with coronavirus?
Thank you. The people who are at highest risk are the people with chronic diseases, people with diabetes, heart disease, lung diseases, smokers. We've seen with diabetes, for example, that people who are less well controlled do worse. And, as an outpatient organization, it's always our mission to try to keep people out of the hospital. But right now, we're really focused on treating those people with chronic diseases, keeping them under control so that people will do better if they do get sick.
Matt, I want to go back to you for a moment and talk about where we are right now with hospital capacity. You petitioned to set up a surge facility at the Fairgrounds for extra ICU beds. It has not been used yet, but are we getting close to that?
Yeah, you're exactly right. The Board of Supervisors had a lot of forethought here, and we secured that location. We loaded it full of equipment, and we were prepared in case the worst was to come. And it's been sitting idle for months. Unfortunately, we're at a point now where we're talking more and more about, is there a need to activate that alternative care site? We've not yet decided to pull it and to start occupying it. This is a collective decision that's made with the other chief medical officers in these other hospitals, but it's available and it's accessible if needed, and it's really an insurance policy.
And Dr. Reynoso Hernandez, we've heard horror stories of hospitals in Los Angeles that are beginning to ration care. And meantime, last week we reported that hospitals across the state are preparing for worst case scenarios. We saw a letter from your hospital addressed to the staff saying that our area is experiencing the worst days of the pandemic right now. And you've had to create plans for those worst case scenarios. What do those plans say? And are we getting close to those being implemented?
Yes, like my colleague have mentioned, we are seeing more and more patients, and you have to prepare for the worst. So those plans are, made in each institution and hospital, but we collaborate as a county, as a city, on how to best address this. And they pretty much try to match your resources to what you can do with the influx of patients. So, you try to calculate certain medical data points to get to a score that tells you who is at the greatest needs and would benefit from those scarce resources when you are there. Right now we're not there. We're kind of close into that, and that's what we ask the public to help us to not get there. But you have to always plan for the worst case scenario.
Of course. All right, we're going to take a quick break because we still have more of our conversation tonight. We've got a lot of questions. Plus, we're going to be talking about vaccines. A lot of new developments over the last 24 hours. When you'll be able to get a shot in the arm coming up a little bit later this evening. We're back in 2 minutes.
Welcome back, and we continue our conversation regarding the concerns over coronavirus in Kern County, and our experts are joining us once again, so thank you all for being with us. Matt, I want to start with you this time. Once again, there are roughly 80,000 people who have tested positive since this pandemic began here in Kern County. Do we know where people are getting infected locally?
So locally, we have some good data that shows that the far majority of the infections occur in households. It's those household contacts, either people that you live with or family and friends that you live with. But as we talk to every one of these cases, more than 60% of those infections are caused from household contacts.
We have been, again, dealing with this pandemic for a little more than 10 months now. And since the beginning, we've had regulations. We've had different types of regulations. And now we're under some of the most restrictive regulations that we've seen since the beginning of the pandemic, at least since March, during the first scare, if you will. Matt, I got to ask you, because a lot of people are wondering, are the regulations helping curb the spread of this virus? Are they working?
Well, these are guidelines that have been issued. They've been issued through orders through the state health officer or the governor, and the intent is to keep people apart. And the science says that if you maintain your distance and you wear a mask, that limits the opportunity for transmission. So I think any opportunity to limit that exposure is a good thing, especially as you talk to my colleagues here and what they're having to deal with in the intensive care units. These are important times. So yes, I think that any opportunity to limit exposure we should embrace.
Dr. Goldis, I want to bring you into the conversation because a lot of people see these regulations, they're hurting. We have a lot of small businesses that are hurting right now. We have kids that are struggling right now because they can't go to school in person. And a lot of people are saying, with all these restrictions in place, we're still seeing a high number of cases. We're still seeing a high number of hospitalizations. From your perspective, though, is this something that could get worse if we did not have these regulations in place?
Well, in fact, it has gotten worse despite the regulations. And the concern is that there are far too many people who still take the recommendations too casually. One of the reasons why we've gotten together here tonight as a group is to help send, I think, a very clear message to the community that we want you all to be very careful, take into account all the precautions you're hearing from the Department of Public Health, really focus on taking care of yourselves by social distancing and wearing masks, and really work on cleaning sanitizing those surfaces, washing your hands, and really just trying to follow very basic rules around how to minimize your likelihood of you or others becoming infected. Ultimately, if you have an opportunity to be tested because you're developing symptoms or you're worried that someone, including yourself or in your household, is getting sick, please take advantage of the website full of information around where to go to get tested. And now, more importantly than ever, start paying attention to whether or not you fall into one of the current groups of individuals who are now allowed to receive a vaccine.
Dr. Cothray, I'd like to bring you in right now because the state has also put some restrictions on elective surgeries, and there's a lot of confusion about that. Can you explain what is being put on hold and which surgeries are still happening?
So we follow several different guidelines, and the current one we're currently following is from the St. Louis University, which categorizes surgeries to where they can be elective and they can hold off for 30 days to 60 days, and some others that can be held off a little longer. So we're trying to do whatever we can to accommodate these patients, but we just don't have the capacity to do that right now.
Dr. Reynoso, do you think that there are going to be other concerns, other health problems in the future because people are putting off going to the doctor on a regular basis? They're putting off getting those procedures that sometimes are precautionary. Are you afraid that we're going to see some other health issues in the near future?
The possibility is there, and we did show that with the first wave. The reality is that, you know, we don't have the capacity to do that, and you have to balance of when you put, you know, your resources where they will be beneficial for the people who are in the hospital, and when you put somebody else at risk for something that sometimes can be postponed. But definitely you see consequences, you know, in the outpatient world, inpatient world of things that you are not able to manage there, they come back worse. And we are seeing that in our ERs besides COVID. You always see conditions that are worsened. So the possibility is there.
All right, well, we're going to take a quick break, and we will have you guys join us in just a moment.
Still ahead, a beloved choir teacher starts off the new year with a harrowing battle with COVID-19. Hear his impassioned plea from his hospital bed for everyone to take this virus seriously. Welcome back. As cases rack up, about 1 in every 11 people in Kern has contracted the virus. And every case is more than a statistic. It's a person, a friend, a loved one, including a beloved local choir teacher who recently shared his experience with the community. I caught up with Kenneth Wichert earlier this week as he continues his recovery.
I'm sorry, I just have to catch my breath a little bit.
His voice is his instrument, but Kenneth Wichert found it difficult to string a sentence together just a few weeks ago. The choir teacher from McKinley Elementary School, who already struggles with asthma, contracted COVID-19, then pneumonia, and landed in the hospital. A stay that tested his faith, as he shared in a tearful Facebook video from his hospital bed.
There are moments when I'm strong. There are moments when I have faith in God and I know He's going to get me through it. And then I read things like a former teacher who works at my school passing away. You know, that scares you.
But after 4 days of treatment at Memorial Hospital, Wichert was back home with his wife and 2 sons. And now a week later, he's singing the praises of his nurses and everyone who reached out, prayed, or stepped in to help his family.
With that first story that 17 did, I had kids from years ago reach out to me. And I think that's what motivated me. It means the world. I mean, they brought back so many memories that I forgot about. And it just made me stronger. I can't get depressed. I can't let this beat me. You know, I'm not done. God is not done with me yet in this world.
Wichert still isn't back to 100%, but he's thankful for the little things.
My son has slept with me every night since. He cuddles with me, and we've just been a family and just been thankful for, you know, everything that God has truly blessed us with, all the prayers and support.
Always the teacher, He hopes the community learns from his experience and takes the virus seriously and remembers not to take a single day for granted.
I'm excited that I have that second chance.
And certainly wishing Mr. Wichert and his family well.
All right, we'll be back after this. Welcome back. As we deal with the worst days of the pandemic, there are moments to celebrate as more people receive their vaccine for COVID-19. And today, some of our most vulnerable received their first dose.
People over the age of 65 lined up to get their vaccination at Omni Family Health. Shot after shot, hope was delivered. This comes a day after the state modified its distribution plan to allow seniors the chance to receive the vaccine. It's just another sign that we're inching closer to ending the pandemic.
Yeah, it's definitely some good news. And that's just the beginning. More vaccines are on the way to Kern County, and Public Health is getting ready to distribute the shots to tens of thousands in the coming weeks.
Yeah, when you'll be able to get your shot next.
This is a special edition of 17 News, the COVID Town Hall. Now, here's Maddie Janssen and Alex Fisher.
Welcome back. Tonight, there's exciting news for many in our community as the most vulnerable in our community begin to receive the coronavirus vaccine.
Yeah, but the vaccine has been in Kern County for weeks now. It was first given to our healthcare workers on the front lines dealing with this virus. And now many of our healthcare heroes have received their second dose, developing immunity from this virus.
Tonight, we checked back in with the first person in Kern County to get the shot a month ago. Now, 2 doses later, Dr. Arash Haydari of Kern Medical says he feels a sense of hope after getting his shot. 17th Eitan Wallace spoke with Haydari and joins us now with his message for the public. Eitan?
Well, Maddie and Alex, Dr. Haydari tells me he is confident in this vaccine, and as the vaccine becomes more widely available, he wants the public to know about his experience, something he believes can bring about the beginning of the end.
History in the making. This was the moment Dr. Arash Haydari of Kern Medical became the first person in Kern County to receive the COVID-19 vaccine. That was back on December 17th. Now, nearly 4 weeks later, Haydari and roughly 1,800 other Kern Medical frontline workers have received the vaccine. Last week, he got the necessary second dose to ensure effectiveness.
The message that I wanted to put up was that this vaccine is safe and I'm confident, and I wanted to make sure that I got it first before I promote it to the next person.
He says out of the roughly 1,800 Kern Medical staff who received the vaccine, just one experienced a rash and another saw inflamed lymph nodes, both treatable. As for him,
fatigueness, lack of energy lasts about maybe a day, and quickly right after that everything resolves.
Haydari, the director of Infectious Disease Fellowship at Kern Medical and the president of the Infectious Disease Association of California, said the vaccine offers hope, something that seemed impossible at the beginning of the pandemic.
In March, when we got our first diagnosed case at Kern Medical, I felt completely desperate. Completely armless, no way to fight.
But the vaccine, he says, has changed all of that.
I was praying for this to happen. So for the first time, we can have something that protects your own immune system to fight against the virus. Probably was the beginning of the end for the virus.
And he wants to let the public know the shot is safe.
If more folks agree to come and get their vaccines, the future is bright. The future is back to normal. And then hopefully this will become history.
And he acknowledges the vaccine process has been rather slow, but production, he says, will catch up to the demand. In studio, Eitan Wallace, 17 News.
All right, let's bring our doctors back in to talk more about this vaccine. A lot of news coming out over the last several days. I want to first go through all the doctors and just get your opinion on these vaccines. There's a lot of concern out there, even to this day, as people receive the vaccine. Dr. Cothery, let's start with you. What is your message to the public in regards to the vaccines that are available to our community?
So I got the vaccine myself, and showing that it is very safe to get. But I think the bigger question to ask is, if you asked any of our patients in our ICU whether they would have a vaccine or get intubated or put on a ventilator, I guarantee 100% would pick the vaccine.
Dr. Goldis?
Yeah, so far our experience with the vaccine has been very favorable, as you heard Dr. Haydari refer. We've now actually given over 2,000 doses, only 3 minor side effects. One actually did have an allergic reaction and was treated appropriately. But I think our odds are looking very good. And so far our experience has proven it to be extraordinarily safe. The message out there, I think, for folks is don't listen to the misinformation. It can't alter your DNA. It's not going to cause any birth defects. It absolutely is a safe and effective vaccine, dramatically effective.
Dr. Hayes.
Yes, I would echo what has been said already. Very, very effective and a very safe vaccine. And that's what we're seeing in our clinics. Minor reactions that you see with most immunizations, and people are doing very well. So we're very happy to be able to, get not only our staff protected, but to get that out to the community.
All right, finally, Dr. Reynoso.
Yes, I will echo what my colleagues have mentioned. I also took the vaccine myself. It is safe and is very efficacious, as we have seen in the data. And for those folk out there, don't listen to the misinformation. You don't want to be an ICU patient. You don't want to be in the hospital. This is a safe thing to do and the right thing to do.
Matt, I want to bring you in now because there's a lot of pressure on public health departments across the state to get these vaccines out as quickly as possible to thousands of people a day. Now, we are starting to see more and more vaccines come into our community, which is definitely good news. We now know that those over the age of 65 can receive a vaccine. So we're starting to inch closer to, distributing these vaccines to a lot of people in the public. How is Kern County going to handle? Kern County going to handle this surge?
Well, the good thing is the state asked all of our local providers and our hospitals to register to become a community vaccinator. And we had more than 90 individual organizations sign up and say they will help to vaccinate the community. So all of those are on our website, on our map. So those that are meeting those criteria for those tiers can actually select the dot that they're closest to, and it pops up with their address and their phone numbers and their hours. In addition to those 90 community providers, as has been mentioned, the county is going to stand up a mass vaccination clinic at the Fairgrounds. We'll launch it next week. We're going to ramp that up, hopefully to do more than 5,000 shots a day. And we're hopeful that more and more providers will come on because this is a community-wide effort. Kern County is a large geographic county. So we're hoping to have many of our healthcare partners stand up and to help vaccinate the public.
Dr. Hayes, I'd like to bring you back in. Who would you not recommend this vaccine for?
Well, obviously, we're not recommending it for anybody who's not been approved by the state and county to get the vaccine. The vaccine's also not approved for young people. We've got, I believe, Pfizer that goes down to 16 and Moderna that goes down to 18 at this point. And we're waiting for further data to know whether we can push that age down. And, if people have had a very serious allergic reaction to a vaccine before, like an anaphylactic reaction where they may have had trouble breathing or had to be taken to the hospital, then we would probably not recommend that you get the vaccine right away.
So, Dr. Hayes, do we have any timeline on when kids could get this vaccine?
We don't yet, but we'll be very happy to roll that out as soon as it comes along.
Definitely. Now, a lot of people, we have more than 80,000 people in our community who have contracted this virus since March. And a lot of people are asking, if I've contracted this virus, do I still need a vaccine? Dr. Cothry, let's ask you, are people who have been infected with this virus, are they eligible to receive the vaccine at some point, or would you say not yet, even if their turn comes around?
Oh, absolutely. You absolutely are eligible to receive the vaccine. So as soon as you get infected and you're done with your symptoms, you're asymptomatic and you're out of quarantine, you can come in and get the vaccine.
How soon would you recommend people get that, and can you be reinfected with COVID-19 twice?
We actually have a few cases right now in the hospital that have been infected twice. So you can, but what I'd tell people is after your quarantine is done, come out and get the vaccine.
Dr. Goldus, let's bring you in really quick. A lot of people since the beginning of this pandemic has talked about herd immunity. We've started to hear from the World Health Organization saying that it could take a very long time before we start to see herd immunity. As you look at the research, as you look at the data, what are your thoughts? Is herd immunity possible?
Certainly, of course, the health experts are citing a figure of 60 to 70% of the community having to either develop antibodies from having been infected or having antibodies as a result of vaccination in order to reach that point where herd immunity becomes effective. So is it doable? Yes. The timeline looks more like it could extend many months, but it could also be shortened by individuals taking advantage of the opportunities they may have right now to get vaccinated. So again, our message tonight, and I think I speak for all my colleagues here, is if you are among those phases or tiers of individuals who are eligible for vaccination right now, help us get to herd immunity by getting vaccinated right away.
All right, and we're going to come back to you guys in just a few minutes. As vaccines started to roll out across the world, a new variant of coronavirus was introduced.
Yeah, a lot of people talking about this. It's supposed to be more contagious than what we're dealing with right now. So what do the doctors think about these new variants and whether it could impact the vaccine distribution? We're back in 2 minutes.
Welcome back. Like we've mentioned before, we're nearing 1 year of this pandemic. A lot of people are hoping the vaccines are the literal shot in the arm we need to finally emerge from these dark days. There are so many timelines and projections, and I'd like to bring our experts in again and talk to Matt first. What do the models tell us about where we are right now and where we're headed?
Well, we had some fantastic models that the state provided early on, and we did track along pretty well with those projections. But it really didn't anticipate the surge that we saw in July, and it really didn't anticipate the surge that we saw beginning in November and December. So it's been difficult for us to project. This is a new virus. We don't have a lot of data to show what happens. We have watched what's happened throughout the world and how that impacts us eventually. So it's not conclusive and really unknown at this point.
Dr. Reynoso, is there any way that we get out of this and end this sooner?
You know, the best way is what we have been saying tonight, you know, getting the vaccine and trying to distance ourselves and get the measures, because we slow the progression of the virus, and that will help us to get out of this sooner. But like Matt mentioned, you know, this is something new, is changing. This virus changed a lot and create a lot of challenges for us to be able to determine, you know, how this is going to end.
You know, over the past few weeks, we've heard about new variants from around the world. We know just a few of them reported in the UK, Japan, Brazil, South Africa. Those are just to name a few. So I have to ask you, Dr. Goldis, what is your concern about these new variants as we continue to see, you know, we already know how infectious coronavirus is. What makes these new variants more concerning?
Well, first of all, let me state that variation of the viral proteins that lie on the surface of the virus itself it's not uncommon for them to mutate and to develop deletions or changes. And what's interesting is that spike protein is where the virus attaches. So on some of these variations, we're noticing more rapid spread, or what appears to be a tendency to being more infective. That just means that these viruses are now more easily obtained, or you become more contagious to another person if you have them. And it's concerning because it just means the sheer number of cases increase dramatically in a given area. The virus in the UK is well over 65 some odd cases now in the US, half of them in California. The variant in South Africa is just run through the South African coastal cities with incredible speed. And so that's the issue. It just puts an undue burden on healthcare systems.
I know there's a lot of concern here. Dr. Hayes, is there some good news at least as we deal with this new variant? I mean, we're just starting to see these vaccines roll out. Is there some good news here in terms of, is this vaccine going to protect against these new variants?
Well, it's very likely that this vaccine will protect against the new variants, but it's something that we'll continue to be gathering data on as we go forward. And, you know, everybody has the same questions when these come up. Will the vaccine cover it? Will the same treatments work? Will it be detected by our tests? And, you know, there's a lot of great scientists that jump on all those questions immediately as soon as these variants are noted.
Matt, I'd like to bring you back in here now and talk about these new variants. Is Kern County actively testing for these, and have we seen any confirmed cases here yet?
So I'll probably defer to my medical colleagues here, but public health does not. We are not aware of any in Kern locally. That sequencing that we're talking about typically hasn't been done historically. I know it's more common overseas, but I'm going to defer probably to my colleagues about what they may know.
Does anybody have anything else to add to that?
Sure, I can make mention that I did check with our lab at Kern Medical, and I was informed that they actually test for 3 different sites when running the coronavirus test on the actual virus. And it turns out that these variants don't come up with 2 of the 3 areas that are looked at when determining whether or not you have a positive test. So if 1 or 2 of those are not present on the test, that gives us a clue that we're dealing with a variant. Now, we're not identifying the variants themselves. We're not doing what's called genomic analysis, but we are aware of a way to at least have some indication that somebody is infected with something other than the usual strain.
Dr. Reynoso, I'm going to bring you in just really quick. I got to ask you, because we're dealing with this this new virus, COVID-19. Do you think that this coronavirus is going to be around for years to come? Are we going to start treating coronavirus similar to how we treat the flu? Are we going to have to go to a pharmacy or a doctor's office and get the flu shot and a coronavirus shot every year? Do you think that's going to happen?
It is a possibility based on historically data with, comparing it with the flu and other even coronaviruses that we had in 2003, like the first SARS. It's a possibility that this will become seasonal, like the flu is. But again, there's a lot of unknown, especially with the variations that we're noticing. So it's hard to predict where this is going to land. But the fact that we are almost a year into this tells us that it's a high possibility that we will have to do recurrent treatment and vaccines to deal with this and become another condition that we treat.
Dr. Cothery, I got to bring you in one last time. Got to ask you, a lot of people are just wondering when this thing is going to be over. When are you expecting Kern County to see some sort of normalcy?
I think that's a very good question. I don't even know what normalcy is now. I think some of the things that don't ever go away is masks don't go away, because they do help us protect from other diseases. We haven't seen any cases of the flu in our hospitals at all, so it's helping with that. But I think as the vaccine gets passed out and more people get vaccinated, I think, I would say early spring, we could start seeing a decline in these numbers dramatically.
All right, we're going to take a quick break here. You've heard the push for months. Get tested for coronavirus, even if you're not feeling sick.
And we're going to talk more about testing and why public health says it's so important for our health and our economy. We'll be back in 2 minutes.
By now, you've probably taken a coronavirus test at least once, but public health officials want you to do it again.
Yeah, public health continues to stress the importance of getting a test, even if you're not feeling sick. There are 11 sites across the county, including the Fairgrounds, Sagebrush Medical Plaza, and Clinica Sierra Vista in Bakersfield, Arvin, and Lamont. All testing sites are available for walk-up or drive-through, and you can find these test sites, plus a full list of all local sites on Kern Public Health's website. There you can find an interactive map in both English and Spanish. A lot of information on that website that you definitely need to check out.
All right, and our experts joining us once again. And Matt, let's talk about testing right now. How many people are we testing here in Kern County on a daily basis?
So we test, really the demand has ebbed and flowed a lot, but there are hundreds and hundreds of tests being performed at each one of these sites. It does vary depending on the day of the week and what previous events have happened, but they have additional capacity. As you said, they're readily available, they're free, and really this is a cornerstone of providing early identification and then helping those that have been in contact to isolate, to stop the spread of the disease. So although we're still talking about testing and vaccines, the testing remains important to us.
How often should people be getting tested?
Well, if you're concerned that you may have been exposed, you're symptomatic, you believe you were around somebody that was ill or subsequently told you they were ill, then you should be tested. It's easy to do. The turnaround time has improved significantly. Now we usually get results in a day or two. And it's just an easy thing to do, and it really helps us provide early identification.
But what if you're not showing any symptoms? You don't think you've been exposed? We've heard a big push to go get tested just regularly, even without those factors.
Yeah, because unfortunately, there is a percentage of individuals that are asymptomatic. They don't know they have it, and they could be spreading the disease. So the state has pushed hard and has actually incentivized the counties to try to push testing as much as possible. So even those that don't have symptoms, the state is saying you should get tested.
Let's talk about the asymptomatic transmission here. Dr. Hayes, I got to ask you, we've seen the CDC talk about asymptomatic transmission and why it is such a huge problem. Why is this so significant, asymptomatic transmission?
Well, of course, when people are symptomatic, it's easy to know that you should avoid them. When people are asymptomatic, we may have a false sense of security that we're safe there if we don't have a mask on, if we're not distancing. We may forget to wash our hands. So we've really got to be thinking that anyone that we come in contact with may have coronavirus. So we've got to do the masking, the distancing, and stay away so we could avoid those asymptomatic cases. It's the only way.
And on that note, there's some good advice right there. We'll end it. We'll end our discussion here. Doctors, thanks so much for joining us this evening to talk about this crisis that is looming over our county right now. You have warned us that we were going to get to this point several months ago, and yet here we are. And I know that it has taken a strain on our healthcare system, so we definitely appreciate the work that you're doing on a daily basis, and for our frontline workers who are in the hospital, in the ICU, taking care of all of our patients. To you all, thanks so much for joining us tonight.
Thank you.
All right,
Thank you.
And we'll be back after this. Welcome back. Tonight we've been talking about the good news on the vaccine front, and it is encouraging to hear that hope is on the horizon.
But it's important to remember that we're still dealing with a crisis here. For several days, we've been telling you about the urgent need here in Kern County for blood and plasma donations. That call for help still stands tonight. Houchin Community Blood Bank says it is most in need of blood types O and A. They're also asking for people who have recovered from coronavirus to donate their convalescent plasma to help those who are fighting for their lives. And if you donate, you'll be entered into a daily drawing for a $250 gift card through the end of the month. You can go to hcbb.com/COVID to schedule.
In the meantime, we know this has been a very difficult time for everyone. You know, people have concerns and they're dealing with an immense amount of stress and anxiety, and that's why the Latino COVID-19 Task Force has a mental health and wellness hotline that you can call if you have concerns about this virus. Just call 525-5900. Great resource that is here in our community for sure.
All right, and thank you for joining us tonight for this special edition of 17 News at 5.
Now stay safe out there, everyone. 17 News at 6 is after the break.